歡迎大家出席。
Welcome to today's press briefing. We have on the stage two doctors with us. Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Quality and Standards of the Hospital Authority. Dr. Zhang will report on today's cases. Good afternoon. As of last night, we recorded 24 positive cases, 19 of which are imported cases. So for the 19 positive cases, they are found with N501Y and T478K variant strains. And for the other cases, the results are either pending or that the viral load is undetectable. So the remaining 5 cases are local cases. At the moment, there is one untraceable case among them, but we have a breakthrough. 12945 is the Sogo sales lady who also works for his family dispensary. Her family members, including her father, are also preliminary positive cases. She's now a confirmed case, case number 12945. Her father is a preliminary positive case. The onset of her father was earlier than this case. On the 1st of January, her father began to have some coughs and fever, and the whole family resides in Asian Coast Tower 8. For the family member who is a preliminary positive case, there is connection with 12945, and the family members were sent to quarantine center because of this confirmed case. The father was later sent to Tuen Mun Hospital due to illness and was found to be preliminary positive. The CT value is 26.4. She lives with her family, and she basically goes to the dispensary, which is located in shop S215 of Hans Plaza in Tuen Mun. The name of the dispensary is Tong Art Dispensary. So she started to have some ailments on the 1st of January. She didn't see a doctor then, apart from visiting the dispensary. Basically, on a daily basis or on alternate days, she would go to a restaurant called Dosing in the same shopping mall called Hans, and their family would have 3 meals a day in this restaurant. On the 7th of January, she went to Loufu Bingsat. That's on the first floor of V City in Tuen Mun Hang Si Wui Road, the first floor. And she frequents Dosing restaurant. And on the 24th of December, she went to a shop. I suppose it's the Outback restaurant. The name I don't recall clearly, in Tuen Mun Town Plaza. On the 29th, she went to a Yao Fat fast food restaurant in Hans. And on the 31st, she went to Fun Hei Min Ga, also in Tuen Mun shopping mall. On the 31st, she went to Outback restaurant. In fact, on the 24th, she went to another restaurant. I'm sorry, I will supplement this information later. Right, on the 24th, she went to a restaurant called Piccolo. She should have been identified earlier, and it is likely that her family member has become a preliminary positive case because of her. And we would ask whether they had gone to the dispensary as well in Hands, HANDS. And a Cathay Pacific Pilot 12611 on further inquiry, disclosed that at about 8 p.m. on the 27th of December, he went to this dispensary to make a purchase. We need to inquire for further details. There could be a connection here, and the whole genome sequencing results will show whether her case is connected to the cluster. On a preliminary basis, we've found her 2 other family members exhibiting some symptoms. Further investigation will be conducted. For these 2 cases, they stayed in hands for quite a long time, and they also had meals in these restaurants. So for those who visited the Hans shopping mall from the 27th of December to yesterday, they would be subject to the compulsory testing notice. Because of the rather long onset period and her frequenting the shopping mall, there is a concern whether there is a transmission in the shopping mall. And I would appeal to the members of the public that should you feel discomfort, you should get tested and see a doctor as soon as possible. There are also 4 other cases linked with an imported case. 12941 is the resident of Mason Building. Last night, some residents were evacuated. We took about 40 environmental samples, and the result of 4 of which are indeterminate. We will verify with the laboratory whether these are positive cases. For others, they are negative. For the preliminary positive cases we referred to yesterday, that is 12960, the family member 12860 had performed massage for a confirmed case. The family member is also now a confirmed case, 12944. And the masseurs performed a 2-hour massage for another confirmed case, 12860 at Joyful Lane on the 3rd of January. For other patrons and staff at the massage parlor, they would be sent to quarantine center. During the massage, they stayed in the room for 2 hours, and they had their masks on most of the time. But there might be instances of the customer taking the mask off and drinking water. 12962 is also a confirmed case. She went to the birthday party on the 3rd of January. The case number is 12962. We also have some preliminary positive cases. All these cases are identified either at the testing center, in a hospital, or in quarantine centers. For one of the preliminary positive case, we referred to that earlier, and that is the staff working at the dispensary. The other is the family member of 12911. They both live in Tower 1 of Jupiter Terrace. The other case is a 36-year-old female. Who works in Wing Yun Tea House in Hong Kong. In the evening of the 4th of January, she, along with a family member, went to the quarantine center. The 2nd of January, that's within the infectious period, this case went to a strawberry farm called Lo Chui in Yuen Long. This case went for testing on the 4th, and then on the 5th, 2 tests were taken in the quarantine center. The result was negative. On the 9th, this case had fever and was sent to hospital, and this is now a positive case. The other family member is a male, 38-year-old.
He was also sent to the quarantine center. He's a surveyor working in Expo Drive East. He's been sent to the quarantine center. He suffered from fever on the 9th of January, and he tested positive. Basically, he would go to work, and on January 4th, he's been to Causeway Bay at about 8 a.m., 757. He went there shopping, and he's working in Wan Chai on January 3rd. At 8 p.m., he went to buy takeaway. On January the 2nd, at 3 p.m., he went to the Strawberry Farm together with the rest of them. On January the 2nd, at Aberdeen Sports Ground, he had a bit of soccer match. We are finding out whether this is the transmission period. On January 4th and 5th, he went testing, and he tested negative. Another preliminary positive case, a 52-year-old or 32-year-old female There was an Indonesian helper who lives in Onling Garden. She's the family member of that family. She's living at the Osh at Landmark. She's working at the mail section. On January the 3rd, she's been to East Point City shopping. She's also been to Yumeitong for a massage session, and that's roughly the period of transmission. Also, another case related to a family member on January the 5th, that person went to the quarantine center on January the 6th. Now, this person has been to the quarantine center on January the 5th, and this one's related to 12841 and 12822. He's living in Wharf Center, and this person is working in an accounting firm. Last day at work on January the 3rd. January 4th and 5th, a test that was undertaken. The test came back negative. She developed a fever on January the 8th and was taken to the Princess Margaret Hospital. On January 1st, she's been to Wulong Kitchen to dine with the family member, and also she went to Wong Tai Sin Temple and had dinner there in Wong Tai Sin. This person has also been practicing singing at the studio with about a dozen or so people, and at night time at about 8 p.m. This person has been to Telford Garden for dinner at one of the restaurants there. And these are the whereabouts that we're tracking. And there are some confirmed cases. Now, there was a case involving a staff member of the CITIC Securities, and this has to do with 12825. And on January 8th, he was sent to the quarantine center. On January the 9th, he developed sore throat and cough. He's unvaccinated, and he's 52-year-old male. Prior to going to the quarantine center, He stayed at the Shortin Hotel, and all the people who stayed there will have to be subject to mandatory testing. On January 5th, he went to Seibo Siktong, a restaurant, for breakfast. And on January 4th, he went to a cafe, De Caro, and also Fairwood for takeaways. Other than that, there is nothing out of the ordinary. Also, a related case. This is a student. "16-year-old female, never mind. A family member of 12913 living in Flora Garden has just been double vaccinated with BioNTech on January the 8th and has been sent to the quarantine center. I'm going to supplement further information about the school that she attends. Earlier, there was a case for which we don't have a source of infection, and we're still tracking down. We haven't been able to achieve any progress. I'd like to say that of late, we have seen a surge in the number of positive cases, and there are so many more close contacts, and the number of people sent to quarantine center has been rising dramatically, and this is posing a severe burden on the capacity. And also bear in mind the shorter incubation period regarding the Omicron variant. And we've been looking at the imported cases, and a lot of them experience onset within a fortnight's time, and some of them experience onset within a couple of days' time. So after the administration has consulted the expert panel, and we decided to shorten the quarantine requirement for local cases. Now, for the cases to be announced, starting from 12914 thereafter, involving the COVID variant, the close contacts will see the quarantine period. That's counting from the last day of contact. The quarantine period will be shortened from 21 days to 14 days. And thereafter, they will have to subject themselves to surveillance. And on the 19th day, they will have to be subject to testing. Prior to 12914, at the Joint Scientific Civic Committee, there was an arrangement whereby if they have been vaccinated, and if they have undergone the blood test, and if they test negative, then they will be serving quarantine for 14 days, and they go home for the last 7 days. Now we will waive the blood testing requirement. Now, given the shorter incubation period for the Omicron variant, that's why we have these arrangements. And for the recent cases, there are people who are unvaccinated. We would like to urge the members of the public who haven't quite got the jab to go and get the jab. There are senior citizens who are affected. There are younger people, younger patients are also unvaccinated. Our worries is that if these community cases were to find their way into the old folks' home, then there will be a really severe outbreak and severe consequences. That's all I have to say for the time being. Thank you.
Dr. Lau will give you an update on HA situation. Good afternoon. As of 9 a.m. today, over the past 24 hours, the HA system recorded 14 reportable cases. In the past 24 hours, 12 patients had recovered and were discharged from hospital. So far, 12,296 patients have recovered and been discharged. As of 9 a.m. this morning, 390 patients are receiving treatment respectively in North End Hospital, Hong Kong Infectious Control Center, Asia World Expo Community Treatment Center, and public hospitals. The 390 patients are all in stable condition. As of 9 a.m. this morning, 1,085 negative pressure beds are in use, operating with a 57% utilization rate. We have 606 negative pressure wards with a 69% utilization rate. I'd like to report on the provision of a Sinovac vaccination program at the GOPC clinics. Starting from the 21st of January, the HA will provide Sinovac vaccination service at 22 general outpatient clinics, so that altogether 24 GOPC clinics will be providing this service. Members of the public could use the online around-the-clock booking system to arrange for vaccination at these clinics. As for patients going for follow-up treatment for the seasonal flu jab and elderly patients above the age of 65, please note that each clinic would only provide one kind of vaccine and not both. And if necessary, please make inquiries with the clinic in question. Whether you're receiving the BioNTech jab or Sinovac jab, may I remind members of the public that there should be an interval of 14 days between the seasonal flu jab and the COVID jab. Let me supplement for the 16-year-old female student. She studies in the Canosa College. She last went to school on the 7th of January. During the infections period, she went to a tuition class in Tin Hau, and she also went to a food hall in the Wharf in Providence Center. And for Hans in Tuen Mun, since we are concerned whether silent transmission is taking place at the shopping mall, the government will arrange for mobile testing booths at the shopping mall. Residents who have visited the shopping mall will please go and get tested. The floor is now open. Please raise your hand and use the mic when you speak. And before you put questions, please state the media organization you represent. This lady. Cable TV. Good afternoon. Well, according to your statement, the quarantine period will be shortened to 14 days given the short infections period. Does it mean that the persons under quarantine will be able to leave home and go out, or would they be required to wear a wristband, or would you rely on their self-discipline? Now, about the Madam Wong Si-nga at the birthday party. Before she went to the birthday party, she had snacks and drinks with a couple of friends in the Western District. Did she conceal her whereabouts? Did the relevant individuals contact you, or did you find out upon inquiry? Did other friends of hers who gathered for drinks went to the party as well? And on which day were they sent to the quarantine center? During the infections period, did they have any movement records in the community? Are you concerned that there might be a number of transmission chains in the community? And may I know where Wong Si-nga had drinks, because you mentioned it's number 115 Connaught Road West. Our reporters went to the location you mentioned, and the shop didn't exist. May I know the name of the shop, please? After 14 days of quarantine, one can be sent home, and then a specimen will have to be collected on the 19th day. This is not a new arrangement. The Joint Scientific Committee back then made the recommendations that after testing negative and after receiving both jabs, if the result is negative, one could go out. Only that another specimen will have to be collected on the 19th day. You mentioned the 43-year-old female whose case was confirmed yesterday. She also went to the birthday party along with 5 other friends who had snacks and drinks together beforehand. I understand they went to a private premises, so it's not open to the public. Anyone providing misleading information or anyone who concealed facts may be subject to legal action if necessary. Next, now news about the preliminary positive case who went for a singing class. What is the address? Is it Causeway Bay, Kowloon Bay? Because there are 4 branches of the academy. What about a dozen people who sang with the case? Did they wear a mask? And about the birthday party, do you have any update on the guest list? And you mentioned that there is pressure on the quarantine center. Would you consider reopening Lei Yue Mun and Sai Kung quarantine centers? What about the whole genome sequencing result of the cleaner on a flight? Is the result similar to the CX flight attendants? The Starry World Music Academy is in Kowloon Bay. For the remaining students, we will need to find out. We are of the view that the singing activity is of high risk, and it is possible that these fellow students may be the close contacts. For the birthday party on the 3rd of January, the guest list now stands at 214, 104 of them having been sent to a quarantine center. We also received calls afterwards. About the quarantine center, I think this is of the public's concern, and we're trying to find ways to increase capacity. About the cleaner of the flight, the WGS test is being done. The result will be out very soon. Next. I'm from Hong Kong 01. The first question is about the owner of the dispensary, who is a preliminary positive case. Is he related to the Moon Palace cluster? The Moon Palace cluster has existed for quite a long time, and he only recalled his whereabouts today. Did he conceal his movements? And about Du Xing restaurant, where he spent 3 meals a day there, is it necessary to send the staff and other customers to quarantine? About the birthday dinner on the 3rd of January, 214 guests attended. Apart from the 100 or so guests being sent to quarantine, there are others who have yet to show up, who are untraceable at the moment. How many sources of infection have been identified? Are there any preliminary positive cases who also went to this birthday party? And in fact, some guests who attended the birthday party admitted that they did not use the Leave Home Safe app when entering the venue. Will there be follow-up action from the government? And like the fellow reporter just asked, a case failed to mention his or her movement before attending the birthday party. Should the CHP issue a warning? And about shortening the quarantine period to 14 days in a quarantine center. And according to an expert, if this trend continues and that we opt for home quarantine instead, we will be surrendering to the spreading of virus. And what would you comment on the capacity of the quarantine facilities?
For the preliminary positive case, that's the dispensary boss. I was still awaiting the genome sequencing to see whether it's related to 12611. Now, basically, he's working at the dispensary at Hans shopping mall, and he would be eating there in the nearby restaurants, and maybe someone has gone there to infect him, and we try to help him jog his memory because he probably can't remember every single patient. As to whether precisely it is related, is it the case that he was infected by the patrons? We still have to follow up on this. Now, the genome sequencing would certainly help. As to the dosing restaurant, we're still looking into this. Now, he would eat there quite a lot. There may be some staff who knows him very well, and they may be chatting a bit. We're still fighting about it, of course. There will be a disinfection at the restaurant itself. Now, the guest list is 214. 104 has been sent to the quarantine center. We do not rule out the possibility that we may not know about somebody else who's been there. So we urge those who have been there to go get tested and get in touch with us. If there are people who didn't use the Leave Home Safe app, I'm sure the department would follow up on this. If there are confirmed cases in which people deliberately misled us or conceal things from us to the detriment of our tracking work, and there will be legal action taken. We are making our utmost effort to quarantine the high-risk people, in particular the close contacts, for the first couple of days, and we're shortening the quarantine period to 14 days, and that there is some scientific basis because for most of the cases the incubation period is pretty short, although there may be some that are longer. So we're adopting a more cautious approach by deciding on 14 days. As to the capacity of the quarantine center, it all depends on how many cases will be arising and whether there are a lot of social activities that are involved, and there may be a whole lot of people who need quarantine. If the number is too big, then the capacity may be a problem. Speaker not coming through. Not yet, no. Not for the time being. Next, please. Gentleman at the back, please. RTHK. Now, for the preliminary positive case who's been to the Music Academy, is it in Kowloon Bay? Yes. And also the birthday party. (12961) before she went to the birthday party, did they dine together in a group of 5? And also the guest list. You've brought this up to date. Do you think that this is a complete guest list, or do you still have to follow up on the guest list? And are you going to be reviewing the CCTV footage in order to come up with a complete list of guests in order to ascertain the precise number? Well, they had a bit of a drink and some snacks before they turned up at the party. We have a longer guest list because some people rang us up, and the organizer may approach them for them to get in touch with us. We do not rule out that there may be some who are approaching us to tell us that they've been there. I know that at the entrance there is no CCTV as such, so there is no way we can follow up by this means. Even with the CCTV, there is no facial recognition. We do need to have the face, the image, before we can match. The gentleman's not speaking through. At about 9:30, they went together. The speaker not speaking through. I don't know about all the people, but they turn up at 9:30. The previous case left at about 10:05. So speaking not, we cannot follow up on this for the time being. Yes, the one in the middle.
You mentioned that close contacts of local cases will now have their quarantine reduced to 14 days. So how about those returning from the overseas? Why do they still need to undergo quarantine for 21 days? And do you think at this moment the spread of the virus has been contained? Like, are all the close contacts of the COVID cluster traced, or is there still silent transmission in the community? Also, with the surge of local infected cases, do you think it's time to suspend school and ask government staff to work from home? Thank you.
Our current measure, because our current quarantine facilities is mainly related to the close contact of confirmed case. So we are now changing the policy of quarantine from 21 days to 14 days. Actually, this measure has been in place for previously for those who are vaccinated and tested antibody positive. Actually, it has been ongoing, but now we have asked, we decided that 14 days is enough for all the close contacts. As for the returnees, the government is still maintaining a more strict measure against the imported cases. I think at this moment, the quarantine arrangement will remain. And as for other social distancing measures, including school suspension, etc., I think the government is closely monitoring the situation, and if there's any measures, they will announce as soon as possible.
下一位，答多個英文問題，嗰邊第三。
One more English question, please.
Will the Chinese New Year holiday be moved to an earlier date due to the pandemic? And as there are more than 200 guests in the birthday party right now, is it possible to trace all the guests? And also, do people subjected to the 7-day home quarantine need to wear wristband? And also, as other reports mentioned that there are 2 horse owners dined with one of the confirmed cases in the Jockey Club restaurants. Are those horse owners among the preliminary positive cases?
May I know which organization?
SCMP.
Okay. We need to closely monitor the situation to see whether any additional social distance measure is needed. For all guests who had attended the birthday party after 9:30, they are subjected to quarantine measures, and we hope that we have found all the guests, but we cannot exclude the possibilities that there are still other guests that has not come forward at this moment. And for the shortening quarantine period from 21 days to 14 days, the close contact who discharged from the quarantine center, they are advised to self-monitor their symptoms. If they have any symptoms, they are advised to seek medical attention or go to for testing. And also, they have to undergo a compulsory testing at day 19 after the last exposure. But they are not subject to home quarantine. So they are not subject to a bracelet or other measures. And for the one who had dined, who had meal in Jockey Club. On further investigation, we understand that their table and the other table, they are not in a closed environment. They are not in a single room, private room. Actually, it's part of the whole area with some partitions. So the partition next to them, there is another partition for the two tables, and there are some other partitions for other tables. So it's a whole area. So this is not different from other restaurants. That's why the other table, we would ask them to go testing, but not quarantine them.
下一位呢邊後邊最後嗰行。
Next question. I'm from Ming Pao. A question on the birthday party. The 5 individuals went to a private premises. Could you tell me the nature of the so-called private establishment? Apart from having snacks and drinks in this establishment, how many others were also inside this establishment would basically be subject to compulsory testing or quarantine? According to the government, if there is a suspicion of concealment of information, you will follow up on this case. For the 12838 case, is the department following up on this lady's case? Any follow-up action? And about the private establishment, is Leave Home Safe app mandatory? Did they use the app? And for the 43-year-old female, for those attended the party on the 3rd, they're required to undergo compulsory testing on the 7th, but they only provided samples on the 8th. Did they come late? And about the whole genome sequencing for the so-called sales lady, and also the same result for the lady in Mason Building, or rather father of 12945, on which date was he sent to quarantine? On the 9th of January, because of the father being identified as preliminary positive, we contacted him and found that he had some ailments. He was sent to hospital. The whole genome sequencing for these cases are still ongoing. The speaker is not coming through. The whole family, do you mean? Because he only tested positive yesterday, and the other case being preliminary positive. For the rather detailed gene sequencing test, it would take about 2 days. We will follow up on individual cases in which there is suspicion of contravention of the law, especially in terms of causing obstruction to investigation to safeguard public health. But I'm not going to disclose details. For the private premises, I'm sorry, I don't have concrete information. I think my colleague is following up on it. Next question. This lady over here. From Economic Times. What is the number of preliminary positive cases today? Among these cases are 6 cases related to previous confirmed cases. And about the quarantine center, as of this morning, 907 units were available. How many close contacts are waiting to be sent to the quarantine center? How severe is the situation now? We still have 907 units available. Why does it sound like we are on the brink of full capacity? And for the shorter quarantine period, what if the case doesn't involve Omicron? Is it the case that for other cases, the close contacts would only observe 14 days of quarantine? Do you have a breakdown of the 104 guests who attended the birthday party and then sent to quarantine? Do you have the breakdown of the guests and the close contacts? For residents living in Mason Building, that is flat D, 6th to 24th floor, have you identified all of them? Yes, according to the information online, we have 907 units available. But this morning, according to the person in charge of the quarantine center, there are still some 800 people to be sent to the quarantine center. So we are almost at full capacity. Now, if it's not if it's not a variant strain case, the normal quarantine period is 14 days. And then during the Delta variant, we extended the quarantine period to 21 days. Now we have Omicron dominant strain. The infectious period isn't as long. Previously, some cases wasn't confirmed until the 19th day. And according to the latest trend, we found that some cases were only identified on the 19th day after entering Hong Kong because they got infected in the quarantine hotel. For some other cases, they carried high CT value. They were re-positive cases. Very rarely would we find a case which is a recent infection that has taken place only after 14 days. For 104 on the list, they are all guests, and their household members are close contacts, and they would be subject to a 4-day quarantine. The speaker is not coming through. Seven preliminary positive local cases in the quarantine center. But I forgot to ask how many in total preliminary positive cases there are. Mason Building, 41 residents evacuated involving 17 units. 1 unit is vacant. Next, this lady in a yellow jacket. I'm from DIM News. Well, the CHP is still unsure whether silent transmission is taking place in the community. Do you think it is necessary to add the tracing function in the Leave Home Safe app to perform better tracing? Is it necessary to compel the whole population to get tested? And in the current situation, do you think it is necessary to suspend schools and reimpose the work from home arrangement? For silent transmission, it means we're unable to trace the source of infection. We found a couple of them, and in fact, we're able to find the source of infection of one of the cases. But first of all, we are not sure of the epidemiological link. The gene sequencing result is pending, and we need to further inquire the details of contact. And even if they're linked, before these cases have been sent to hospital, they have probably stayed in the community for some time, so we are worried that there might be silent transmission in the community. The second point is that the case who works in various retail outlets is untraceable. Although the gene sequencing result shows a similarity with the flight attendant's case, her case is still highly transmissible. Or else we need to find the source of infection to make sure that there aren't generations of infection. As for other measures you mentioned, I think we need to consider the matter comprehensively, and the government will make announcements if necessary.
The one in grey jacket at the back, please. Dr. Chuang, TVB. For the birthday party cluster, there were 5 who went to a bar, other than the 37-year-old and 43-year-old who have been confirmed. What about their friends? Are there any preliminary positive cases? Also, for the Twin dispensary, the proprietor there, the CT value is 26.4. How risky is this? Is it particularly high or is it particularly low? Does the CHP know about the situation? Did he wear the face mask the whole time in the dispensary? Like you said, that he would go to the dosing restaurant for 3 meals a day. And how many people were there at the same time, and how many people shared the table with him? Did he engage in any conversation with no mask on for any period of time? For the birthday party, there were 2 who went to the birthday party. 3 have been sent to the quarantine center. No preliminary positive cases have been identified. We're still looking at the samples. For the dispensary, the proprietor developed discomfort on January 1st, and the CT value stands at 26. It's not particularly high, it's not particularly low. He's unvaccinated himself. So we will have to ascertain the level of antibody to see whether the onset of illness on the 1st of January has anything to do with the infection. I know that the HA is following up on this. Dosing restaurant, we're still finding out about the situation. He would go there on a fairly regular basis. Maybe he has contact or exchanges with the staff. We're still finding out. The lady at the back, please. In media, 12911, the 3-year-old child has been to the Six Garden restaurant. Is this one of the preliminary positive cases that have become positive? The 36-year-old preliminary positive case and also 12821, are they related in any way? I think so. 12911 from Six Garden restaurant. There are family members, and maybe the transmission might not necessarily take place in the restaurant. The transmission might be from 12811. Sorry, not 12811. Let me see. I want to make sure the number is right. Bear with me. Right, number is right. 12811. Right. He was sent to the quarantine center because of 12811. Well, last question. AM 730. You mentioned the Connor Road West, the private premises. Do you have the precise address? Now, of the 5 people, how many of them were not part of the birthday party? Now, under 599F or 599D, if someone conceals the information, one would face a legal liability. Do you think they have the obligation to come forward? And also the 20-year-old girl who's been to Shishiro, and why didn't you mention this particular place? And in recent times, we haven't seen any public transport being listed. Or is it because your capacity cannot cope? That's why you haven't provided the information. City securities, and there are some staff members and some visitors who became positive. Is there an outbreak there? And also, the 16-year-old person, is it the 6th generation? And also the accountant firm, do you have any further information? And 14 plus 7, can you explain to us once again for the remaining 7 days, other than going for the test, what else would people have to do? Right, the PwC case, the person is a 31-year-old male. Shishiro, I have to ascertain the time and see whether there has been any mandatory testing. Public transport, the number is really massive, and each case generates so many trips on the public transport. So we would focus our attention on the food establishments and the places that they've been spend a longer time in order not to cause confusion. CITIC securities, indeed, there has been an outbreak because there are 3 staff members plus 1 visitor who are involved. Whether this is the 6th generation, I have to do the counting. Speaker not coming through. Well, as I said, I didn't follow these very closely. I have to have a look at this again. Speaker not speaking through. Well, for the time being, we don't have a lot. There is a lot of compulsory testing requirements. If there is a breach, one would face some legal liability. But under 599D, if anyone were to lie to us, which undermines the track and trace efforts, they would face a legal liability. You mentioned the 5. How many of them are not on the list? Yesterday, we said there were 2. One of them have tested positive. That's it for today. Thank you all very much for coming.